Psychology is the study of our mind and behaviours. It helps us to understand why we feel and act in certain ways. It can also be used to help people change. So why is psychology important in pregnancy? Firstly, psychology can help us to be more healthy. When we are pregnant, we think about how our lives are changing. This can lead us to think about our behaviours, and we might want to change them for the future. Psychologists call this a teachable moment. We can use psychology during this teachable moment in 3 ways. 1. Design and conduct research to understand why we do certain behaviours. 2. Think of ways to help pregnant women and their partners change their behaviour before and after having a baby. 3. Deliver training to healthcare professionals to support women and their partners. Research conducted by psychologists and midwives found that women want to change behaviours, such as eating and physical activity, but they want to make these changes after they have had their baby. GPs and midwives are well placed to speak to women about making these changes, but need to feel confident to speak to women after giving birth. Psychologists and PhD students at the University of Manchester are conducting research to understand how best to have these conversations and the best language to use. Research tells us that some groups of women, such as those with a BMI over 30, face more difficulties when breastfeeding than women with lower BMIs. A recent programme of work conducted by psychologists explored these difficulties and how best to support women to overcome them, and used this knowledge to design an intervention called the Breastfeeding Workbook. One example of something that can help overcome barriers to start breastfeeding is being shown different ways to hold your baby. In future work, we aim to also adapt the workbook into a training package for health professionals to increase the breastfeeding support. The second way psychologists can help is when pregnancy does not go the way we want it to. Psychologists can support women and their partners, as well as healthcare professionals in maternity care. When a pregnancy does not go as planned, we can experience feelings of sadness, guilt, and anxiety if we become pregnant again. Research by psychologists, midwives, and obstetricians is taking place to understand what support women and their partners want to receive in subsequent pregnancies following a stillbirth. Finally, psychology has informed training for midwives to help support women and partners who are pregnant after a previous stillbirth. The training used behaviour change techniques, BCTs, to help parents manage anxiety. Psychologists see these BCTs as the tools in our toolkit. If you're interested in learning more about this research and would like to get involved, please contact us at MCHP.